What we are doing at Teesside is introducing a Students in Recovery plan where we host weekly on-site campus meetings where we support the students. So there's those students that would require treatment, there's a lot of students in recovery, but there's also a lot of students who've been affected by addiction via, I suppose, a third-party outlet, if you like. So whether that be a family member or a friend, a sibling. This isn't exclusively for people in recovery, it's for people who've been affected by addiction as well. I do see a shift in attitudes towards drug and alcohol use on campus, and I think it's good to have something there for those people that just don't want to partake in that stuff, you know. So even if they're not a student in recovery, I think creating a culture where we become more encouraging and accepting that it's okay just to be teetotal and just to be, you know, mindful and happy. It fits in perfectly, really, because whether a university wants to admit it or not, there is an issue with drug and alcohol usage, because there is everywhere else in the country, and mental health and addiction, you know, marry together perfectly, and so you generally don't have one without the other. So there's an absolute need for that joint working between student services, wellbeing services, and us as a CRP. Students all across the country, you know, get sucked into this culture where it's really heavily focused on partying, alcohol, drug consumption. Very much for recreational use at first, but that can lead to problems, and there are a lot of students who are in recovery on campus, not just here, elsewhere, that need that support. There are also lots of students who may not know that they need that support, and there are also a lot of students who are already in recovery going into higher education and need that support network on site. So they need that peer-led mutual aid support, other students in recovery supporting students in recovery. The attitudes from the staff are fantastic. They recognise, you know, the good work that we're doing and how much it's needed. And I recently did a presentation for one of the schools, so the School of Health and Social Sciences. I was in there and their quarterly staff meeting, so I presented who we are and what we do to over 200 members of staff. And the reception I got back, the feedback I received was incredible. You know, they're so open to this concept. They're so supportive of it, because actually there's a real strength in being able to see it and acknowledge it and promote it, as opposed to be afraid that it's there, because it is there.